thank you everybody for joining us for the second part of the session today. So in this one, as I had mentioned earlier this morning, this session we're going to focus specifically about the BadgerCarePlus eligibility rules. And again, this is Rachel Widoff, Healthcare Eligibility Policy Analyst from the Wisconsin Department of Health Services. All right, so today's agenda, I'll go over the purpose, the overview of BadgerCarePlus, and more specific information about non-financial rules and then financial rules as well. So the purpose, again, the purpose of this training is to provide navigators, CACs, partners, agents, and brokers with an overview of the eligibility rules for the BadgerCarePlus program. As a reminder, session 1 earlier today was on applying for Wisconsin's healthcare programs, and session 3, which will be tomorrow morning, will be on eligibility rules for EBD Medicaid. So just to repeat what I said earlier today, the available programs for BadgerCarePlus, it covers children ages 0 through 18, parents, caretaker, relatives of children ages 0 through 18, pregnant women, and childless adults ages 19 through 64 who are not receiving Medicare. And again, by childless adults, we mean people who don't have minor dependent children in their home. All right, so getting into the overview. So just sort of a caveat up front, to keep in mind, this training provides an overview of the eligibility rules for BadgerCarePlus. It's not intended as a training on how to determine eligibility. Really, only IM agencies can determine eligibility. So the policies described in this training are subject to change. And in many cases, there's maybe more nuance or different scenarios that sort of gets into it in a little bit more detail that I'm not able to get into in this presentation. But if you are interested, when we do post updates to the program policy in various places, you can see it again at that Forward Health page on the dhs.wisconsin.gov website. You can also sign up for alerts. So there is, so sometimes when we do have, policy changes or major policy changes or something that folks might want to be aware of who work with these programs, you can sign up to get alerts to let you know when those happen. So that's at the dhs.wisconsin.gov/alerts.htm. So getting into non-financial rules for BadgerCarePlus. So again, I won't go over this whole list again, but again, you must be one of these following populations to qualify for BadgerCarePlus: so child, parent, caretaker, relative, pregnant women, and childless adult. Benefits for some children with higher household incomes are funded through the Children's Health Insurance Program, CHIP. So this includes children ages 1 to 5 with income above 191% of the federal poverty level, and children ages 6 through 18 with income above 156% of the federal poverty level. So as a result, those CHIP populations are subject to different rules regarding backdated coverage and crowd-out policies. So just so you're aware, if it seems like, if you hear that we're saying, well, these children over here have these rules and these children over here have different rules, that's sort of the difference, is because some of these children at the higher income levels are actually under the CHIP program. So to qualify for BadgerCarePlus, you must be a Wisconsin resident who's physically present with an intent to reside in Wisconsin. You have to be a U.S. citizen or qualifying immigrant. You must provide a Social Security number with some exceptions, and you must supply required information and verification within the required time frame. And so that's what Michelle had talked about in the earlier session this morning, sort of about that BCL checklist or the proof needed and the timelines around that. You also must pay premiums if they're required. Some of our populations do require monthly premium payments. And you must meet crowd-out rules when they apply. So this is getting into sort of that different policies for the CHIP population. So children with higher incomes may not qualify if they have access to or coverage through certain employer-sponsored health insurance. Some pregnant women who are immigrants or inmates may not qualify if they have other health insurance or have access to employer-sponsored health insurance. So those are just some limitations for those populations. All right, so I think I'm going to pause real quick to see if there's any questions, Adam, or anything about that overview real quick?
Yeah, somebody asked, and this might be covered later in other programs, I'm not sure, but somebody asked, what about a non-resident who is pregnant? I think in terms of non-financial eligibility, what program or programs would they be eligible for?
So, so like a non-resident of Wisconsin, or like a non.
I'm guessing that's referring to immigration status, if I had to guess.
Sure. So for immigration status, for pregnant women, the person just needs to be legally present in Wisconsin if they're pregnant. So if they're in the United States and they're under a legal presence status, which is fairly broad, then they would sort of meet that qualifying immigrant criteria as a pregnant woman. For non-pregnant adults, it's a little bit stricter on who's sort of counts as a qualifying immigrant. But if there are specific questions about someone's specific immigration status or their visa or what they're residing in the U.S. under, then the Income Maintenance Agency, I would recommend maybe contacting them. They would probably be able to provide more specific information on that. They can also, you could also look in the BadgerCarePlus handbook. I think we had shared a link to that in the earlier session, but you could also probably just do an internet search for BadgerCarePlus handbook Wisconsin, and it would come up. And there's one chapter, I think it's somewhere in chapter 4, I believe, that one of the sections just completely goes over immigration. There's a chart there and some other information about sort of what we mean by qualifying immigration statuses. So that might also be helpful if somebody wanted to, take a look at that in more detail in the BadgerCarePlus handbook.
Right, and if you are talking about somebody who does not have qualifying status at all, so completely, non-qualified, has no status that can be counted for BadgerCare, there is the BadgerCarePlus prenatal program, which is slightly different, but would cover that person in that case while they're pregnant, only while they're pregnant for that program. Go ahead.
Oh, I was just going to say, yes, that's correct. And the prenatal program, that would also be a similar application process. So the income maintenance agencies would also process those applications for that prenatal program. So again, the income maintenance agency, that might be a good resource if you have somebody who is pregnant and is looking to see what benefits, what possible sort of variation of the BadgerCarePlus program they could be eligible under.
Okay, so one person asked if the CHIP program has copays.
Yes, I believe that there are. I think we might get to it later in this presentation. I'm sorry, I can't remember off the top of my head where we talk about it. But again, I would recommend looking in the Enrollment and Benefits Handbook. That was publication 00079. That will have sort of a layout of sort of covered services and copays. But again, the rules I think that we talked about copays earlier in the earlier session this morning would apply to those CHIP kids as well. So what we talked about there would apply to that population.
Yeah. And then the next question is digging into financial rules. So I think that is a good transition to this section.
Yep, sounds good. All right, so we'll go into the financial rules for BadgerCarePlus. So financial eligibility is based on the household's expected monthly income. In some circumstances, annual income may also be considered. We'll get into that a little bit later on those circumstances. Assets are not considered when determining eligibility for BadgerCarePlus. So we do not look at somebody's assets for BadgerCarePlus eligibility. That is different for the EBD Medicaid, though. They do look at assets for many, if not all, of those EBD programs. So Michelle Furr will be talking about that with you tomorrow in more detail. All right, so sorry, this slide's a little bit crowded here, but this is talking about income limits. So by the different populations. So for adults, the household income is at or below 100% of the federal poverty level. And just to note down here, I've been using the term federal poverty level, or FPL, but it is a federally determined income amount that is scaled based on household size and is usually adjusted every year. I think we usually update ours in around February, early February every year. So probably around the beginning of February of 2021, we will update all of our FPL, all of our tables on our websites and on our handbooks to show whatever the amount is for 2021. Current FPL amounts can also be found here. This is the sort of the BadgerCarePlus FPL site at the Wisconsin dhswisconsin.gov website. So going back up, I did say the adults, children household income is at or below 306% of the federal poverty level. And for pregnant women, similarly, it again is household income at or below 306% of the federal poverty level. You may be wondering why this sort of odd number of 306 and why it's that and not a straight 300 or something like that. And it's due to there's just some like disregards and conversion factors in calculation. I won't get into it. It's pretty technical, but that's why. Just saw an alert saying we're having problems with the network. Can you hear me still?
Adam's muted. Yes, I can hear you.
Sorry,
Okay.
I was on mute. Yeah, you went away for about 10 seconds, and while you were explaining the 5% disregard, but we can hear you now.
Okay, great. Yeah. Basically, my 5% disregard was me saying, like, I really don't know enough to get into it here, but that's sort of why we have that sort of that calculation conversion factor. Why we get that weird 306. And then here is sort of just showing some examples of what this actually means in dollar amounts for the 2020 federal poverty level amounts. As you can see, I won't go over this, just read through this, but as you can see, it sort of shows how it differs by household size. And again, if you go to the table that we have at this link, it will go, I don't know how many if we go to like 10 household sizes, 10, but it goes much more than 5. So you'll be able to see a more complete chart, and it will also have some other percentages that in between 100 and 306%. So it'll show some other percentages through that as well, so you can see those actual dollar amounts. All right, and this is just another graphic sort of showing the income limits for BadgerCarePlus and for the advanced premium tax credits that you're familiar with through the marketplace. So it sort of shows where the BadgerCarePlus goes up to for these different populations, and then at what point sort of they would move into the where they would have possibly have advanced premium tax credits that they would be eligible.
And if you're not familiar with those yet, it's because that you're brand new, and we're going to talk about it during the sessions over the next couple days. So.
Yep. Thanks, Adam. So I probably just did a spoiler for some of you.
No, yeah, spoiler. Yeah, exactly. Big spoiler.
Yep. So yeah, so this is just sort of showing sort of how where that transition point is out of BadgerCarePlus when people sort of reach the BadgerCarePlus income limit, excuse me. All right, so getting into how income is counted. So for BadgerCarePlus, we use what's called modified adjusted gross income, or MAGI, as it's also known, rules. And that's what's used to determine household size and household income for BadgerCarePlus. So you may have heard of, adjusted gross income or modified adjusted gross income in taxes or filing taxes. And so that really is where the term has come from. A lot of these rules that we use for BadgerCarePlus comes from tax rules. So MAGI rules are also used when determining eligibility for advanced premium tax credits. Again, the APTCs at the marketplace that you'll hear more about in future sessions. And then, so using these MAGI rules, IM agencies determine how big is the household, which household member's income is counted, what types of income and deductions are counted. All right, so I think it's time for poll question number 1. All right, I'll just read this off. The income limit for BadgerCarePlus for pregnant women is blank % of the FPL. A 100, B 306, C 200, D 138.
I'm guessing that's enough time for people to respond. I don't want to cut anybody off, but I also don't think that, if you're following along, you're probably sitting and waiting for the results right now. It is not an exact science.
All right, looking at the results, it looks like most folks put B 306%. And that is the correct answer. So for pregnant women, the income limit is 306% of the FPL. So, all right. So thanks, everybody. All right. So I think moving on. So getting into sort of these more detailed questions, how big is the household? So determining household size using Magi rules can be complex. I'm sure, especially as some of you who have worked with BadgerCarePlus in the past know, it's not always quite as easy as it could be. In some cases, for tax rules, in some cases, household size is based on who plans to file taxes and whom they plan to claim as tax dependents. And for relationship rules, in other cases, household size is based only on how household members are related to each other. So as a result of these rules, different household members can actually have different household sizes, if that's not confusing enough. Something to note, for any pregnant woman included in a given household, the household size is increased by the number of babies she's expecting. And if it's not sure, then it's usually just one. We just assume one. Verification of pregnancy is not required unless the IM agency has information that contradicts the person's statement. So getting into tax rules. So at this point, if you have that forming a Magi group sort of flowchart document that I had shared at the very beginning of this might be a time to pull it up. To look at this, just to help sort of follow through and kind of maybe help see how somebody is sort of landing in these tax rules and how we're determining that is what we're going to be using to form the household. So in most cases, if an adult in the household is planning to file taxes and is not being claimed as a tax dependent, the household includes the tax filer, their spouse, and tax dependents. So example 1, Joe and Liz are married and have 2 young sons, Matt and Leo. Liz is pregnant. Joe and Liz plan to file taxes jointly and claim both children as tax dependents. The family's household size is 5, Joe, Liz, the expected baby, Matt, and Leo. So that's a pretty basic, straightforward scenario. So another example here, Rich is a single adult who lives with and provides financial support to his elderly mother, Maggie. He plans to claim her as a tax dependent. Rich's household size is 2, Rich and Maggie. All right, and then relationship rules, which was the other way that you can count a household. And I should note up front that you would either fall into tax rules or relationship rules. It's not, you're one or the other. You can't be both. You can't choose which is more advantageous to you or anything like that. You are going to be clearly one or the other. So in most cases, if an adult in the household is not planning to file taxes, the household includes the adult, spouse, and their children under age 19 who are living with them. So in the example here, example 3, Mike and Kelly are married and have a young daughter, Fiona. Mike and Kelly do not plan to file taxes. Each person's household size is 3, Mike, Kelly, and Fiona. Example 4, Lars and Laura are childless adults who live together but are not married. Laura is pregnant. Lars's household size is 1, so just him. Laura's household size is 2, which is her and then the baby. So relationship rules are also used for children who are claimed as tax dependents by someone other than their parent. Children who are claimed as a tax dependent by a parent who lives outside of the home, which I think is probably is a common scenario. Children who live with both parents, but those parents are not filing jointly. Again, I think that's another common scenario. When relationship rules are used for children under age 19, their household includes their parents who are living with them and their siblings under age 19 who are living with them. So more examples. So this is getting into some of the more complicated scenarios here. So example 5, Jaden, Rylan, and Warren are teenage brothers who live with their Aunt Sarah. Sarah plans to file taxes and claim all 3 brothers as tax dependents this year. Using tax rules, Sarah's household size is 4 because she is a tax filer with 3 tax dependents, the three nephews. Because the brothers are being claimed by someone who is not their parent, relationship rules are used for the brothers' side. So if you're following sort of that flow chart, if you were looking at and using one of the brothers as a target, it would take you down to relationship rules, and then you would see the questions like about how if somebody's being claimed by somebody who's not their parent, is sort of following that flow chart down. So each brother has a household size of 3. Himself and his 2 brothers, because again, we're looking at relationship rules for them, and it's counting their siblings under the age of 19 who live in the house with them. Example 6, Jocelyn's divorced and lives with her 17-year-old daughter, Maisie. Jocelyn plans to file taxes, but Maisie's father, Chris, plans to claim Maisie as a tax dependent this year. Using tax rules, Jocelyn's household size is 1 because she's a tax filer with no tax dependent. So this is even though she is living with Maisie, Jocelyn's household size is 1. Because Chris is a parent who lives outside of the household and is claiming Maisie, relationship rules are used for Maisie. And Maisie's household size then is 2, herself and her mother, because relationship rules will count, the child under age 19 and their parent who's living in the same household. So example 7, another more complicated example. Dan and Jackie live together, but are not married. They have 10-year-old twins, Sadie and Lily. Dan plans to file taxes and claim both children as dependents. Jackie also plans to file taxes. So Jackie and Dan, because they're not married, they cannot file. They cannot file jointly. So using tax rules, Dan's household size is 3 because he's a tax filer with his 2 tax dependents, Sadie and Lily. Also under tax rules, Jackie's household size is 1 because she's a tax filer with no dependents, so it's just her. For the twins, relationship rules are used because each parent, their parents are living together but not filing jointly. So again, if you're following that flow chart, for one of the twins as a target, you're getting into the relationship rules side of that flow chart. In that case, for each child, household size is 4 because it includes the child, her sister, and their 2 parents who are living in the household with them.
And Rachel, just to clarify, so this was pretty complex, which is good because I think that, people do need to be exposed to stuff. This is a single application though, correct?
Correct. So all these people can apply on the same application. Dan, Jackie, Sadie, and Lily, they're all on the same application. They don't need to file separate applications for them. So they're all together. It's just that when we're looking at, when the income maintenance agency is looking at whose income is counting towards someone's eligibility for BadgerCarePlus, they might have different income limits. For example, when that earlier slide, when I was showing sort of for a household of 1, here's what the dollar amount is at 100% of the FPL. For a household of 2, here's what the dollar amount is at 100% of the FPL, or 306% of the FPL. That's where these household sizes become a factor. Is at that point when determining eligibility, not when filing an application.
Sure. And question came in, what verification document would the state use to determine or verify a family size that was claimed on an application?
Sure. So for the most part, there's questions on an application that sort of ask about who's intending to file taxes, who's intending to claim who as a tax dependent. So it's getting into sort of questions like that. For the most part, income maintenance agencies will, depending, for determining who's a tax filer and who's a tax dependent or so on, income maintenance agencies will take what applicants put on their application. We're not gonna ask you to give us, your tax, what your 1040 or whatever, to tell us who claimed who. For the most part, this is sort of applicant attested information. That in this case, it would be Dan and Jackie on their application saying, here's how we're planning on filing our taxes and who we're claiming as dependents. Any
Great,
other
thanks.
questions?
Not right this second. Thanks, Rachel.
Yep. So more about household size. So tax dependents can be included in someone's household size, even if they are living outside of the home or are deceased. So again, so this sort of, adding on to what I said earlier about people being on applications, even though they're maybe in different sort of tax groups, if somebody is living outside of the home, some information about them may be needed for the application, but they wouldn't be able to apply on that same application. So I think we'll get to that a little bit later. But yeah, it does get kind of complicated when we're talking about these sort of outside tax filers or outside tax dependents. Spouses must always be included unless they are living separately and filing taxes separately. To be considered to be living with a parent, a child under age 19 must be in the parent's home at least 40% of the time. If parents are divorced, only one parent can claim the child as a tax dependent each year. And tax rules are based on how the person plans to file taxes for the current tax year. So going back to the bullet about only one parent can claim the child as a tax dependent each year, that might be one scenario where an income maintenance agency might follow up with the applicants or the members to sort of figure out who really is the parent claiming the tax dependent. So that might be something where normally the income maintenance agency would just take the information that was provided on the application. But if two parents that don't live in the same household and are not filing taxes together both apply and are both saying they claim this same child, the income maintenance agency might follow up at that point to ask for more information to determine who really is claiming the child as that tax dependent. So just for more about households, this is sort of where that flow chart, that document that I had shared earlier that hopefully some of you might be able to be looking at right now, that's where to find it. It's posted in our BadgerCarePlus handbook in chapter 2.3.3. So if you ever need to refer to it in the future, that's where you can find it, or send a link or whatever to anybody else you're working with who may be interested in seeing that chart. Okay, so it looks like now it's time for poll question number 2. Oops. All right, I'll just read this real quick. In most cases, if an adult in the household is planning to file taxes and is not being claimed as a tax dependent, the household should include which individuals? A, the tax filer, B, the tax filer's spouse, C, tax dependents, D, A and B, or E, A, B, and C. All right, so looking at the results, it looks like most folks did E, A, B, and C, and that is the correct answer. For that tax household, we'll look at the tax filer, their spouse that's a co-filer, and any tax dependent. All right. So moving on to whose income is counted. So in general, all household members' income is counted. However, if a household member is a child or tax dependent of another household member, his or her income is only counted if he or she is expected to be required to file a tax return for the current year. So this includes children or tax dependents who expect to have more than $12,400 in earned income, more than $1,100 in other income for the tax year. For this rule, other income does not include child support, Social Security, supplemental security income, also known as SSI, workers' compensation, veterans benefits, money from another person, or educational aid. So that's what it does not, other income does not include those things. And again, these thresholds are updated annually, similar to the federal poverty level. So just revisiting some of our earlier examples. So this is getting into sort of the income for those earlier examples. Oops, I'm sorry. Went too quickly. So example 6, Jocelyn's divorced and lives with her 17-year-old daughter, Macy. Jocelyn plans to claim taxes, but Macy's father, Chris, plans to claim Macy as a tax dependent this year. So again, using tax rules, Jocelyn's household size is 1 because she is a tax filer with no tax dependents. Because Chris is a parent who lives outside of the household and is claiming Macy, relationship rules are used for Macy. Her household size is 2, herself and her mother. Macy has a part-time job at McDonald's and is earning approximately $400 a month. So for Jocelyn's eligibility, Jocelyn's the only household member, so only her income is counted for her eligibility. For Macy's eligibility, she is the child of another household member, Jocelyn, so Macy's income is only counted if she's expected to be required to file for taxes. Macy expects to earn $4,800 this year from her job. So she's below that expected to be required to file threshold, which, as you may remember, was $12,400, and her income is not counted because of that. So only Jocelyn's income will be counted for Macy's eligibility. And if Macy were to earn $1,200 a month or $14,400 a year, then she would be above the threshold, and this income would be counted in addition to Jocelyn's income for Macy's eligibility. So again, Jocelyn, because she's a household of 1, would not include Macy's income, but Macy, because she's a household of 2 of her and Jocelyn, in this scenario, if she was earning this much above that threshold, it would count both Jocelyn's income and Macy's income for Macy's eligibility. Right, so getting into what income is counted, most taxable income is counted for BadgerCarePlus. This includes, but is not limited to, taxable gross earnings from a job, taxable earnings from self-employment, unemployment compensation, financial aid if used for living expenses, taxable retirement, pension and annuities, and interest and dividends. Just note that Social Security income is usually not taxable, but it is counted for BadgerCarePlus. So common types of income that are not counted for BadgerCarePlus include child support, supplemental security income, again, SSI, gifts or other money from another person, workers' compensation, and veterans benefits. Again, that's not counted income usually. Deductions. Pre-tax paycheck deductions are allowed as BadgerCarePlus income deductions. For example, pre-tax contributions to health savings accounts. Tax deductions listed on IRS Schedule 1 and Form 1040 are also allowed. Examples include student loan interest paid, higher education expenses, and self-employment tax. So basically these deductions are sort of like taken off of your, what we would normally count as income for BadgerCarePlus. Excuse me, just to know, itemized deductions like mortgage interest and charitable contributions are not allowed. Though I think with the change to tax rules, most people are probably claiming the standard deduction in most cases. All right, poll question number 3. All right, I'll just read this off. True or false? Workers' compensation is countable income for BadgerCarePlus. All right, looks like we got the answers, and looks like most folks picked false, and that is the correct answer. Workers' compensation is not counted for BadgerCarePlus. All right. All right. Okay, before I get into special situations, Adam, have there been any additional questions?
There haven't, which is surprising. That content is pretty dense, so people might still be wrapping their head around which of their thoughts might make for good questions. I will say, just for the brand new assisters who are seeing that for the first time and say, "Oh wow, that's overwhelming. I'm really not a math person," what have you. Just a reminder back to an earlier slide, it is the IM agency's job to determine eligibility. You should know these rules, and you should know where to look them up in the BadgerCare handbook. But a lot of the time, when you're working with a consumer or you're advocating for a consumer, you'll probably end up calling the IM worker, and talking this through with them and saying, hey, I was just doing this and I think this should be counted. What do you guys have in your system? And honestly, that's some of the best, language I can give you for talking these through with IM agencies, because they really know what they're doing. Sometimes mistakes are made, but they are the ones who make the determination and are experts in the rules that Rachel just went through.
Yeah, thanks, Adam. I second that. Yeah, the expectation is not for you guys to know these off the top of your head or all these rules. As Adam said, it's just sort of to give you an idea so that you understand these rules and why some people, you might see cases where some people are eligible for benefits and some people aren't, and just to sort of get an understanding of why that might be, and then to also sort of know, how to best facilitate, communications with the person themselves and then with the income maintenance agency as needed to sort of get to the bottom of any questions that they have about that. So, but yes, I understand this is totally overwhelming. The flow chart, even though that does have information on it, it's sort of hard to wrap your mind around, especially if this is the first time you've seen this. So don't panic too much, but just,
Right.
just sort of to let you know.
Couple questions that come in while we were going through that. One person would like you to explain the workers' compensation again. I believe that's at least why it isn't counted.
Sure. So I guess I will say off the top of my head, I'm not exactly sure the exact reasoning on why it's not counted. I know for a lot of these other things, types of income that are not counted, it's because it's not taxable. So for BadgerCare Plus, a lot of the income that we count it's because it's taxable income. So I guess I'm not personally super familiar with workers' compensation, but if it's income that's not taxable income, perhaps that is the reason why we do not count it for BadgerCare Plus. Another reason, there's certain income types that we don't count for BadgerCare Plus because there's Medicaid law or other sort of laws or regulations that say this income is not counted when determining someone's eligibility for public assistance benefits. So there's if you're looking at the BadgerCare Plus handbook online, chapter 16.2, there's a whole long list. I think there's maybe close to 50 types of income listed there that we do not count for BadgerCare Plus. And again, there could be various reasons. It could be because it's not taxable income. It could be because there's a certain law or something that says this income is not counted. So there's a few different reasons why something could not be counted. Unfortunately, I don't exactly remember off the top of my head what it is for workers' compensation, but that's sort of possible explanation.
Good rule of thumb though, Rachel, for the start of that is if it's taxable or not. That's kind of your go-to for how to think about those. And then somebody asked about the information that's on the screen right now, so that's good. And then one more question is for Magi rules, do the income limits that you talked about based on age earlier for children, over age 5, for example, or 1 to 5, are those the income limits that apply?
So I guess I should give a bit of background. So there's at the federal level, there's sort of I guess sort of two different programs for children's healthcare. There's Medicaid, as you guys are probably familiar with, and that sort of covers those, I guess, the lower income within the BadgerCare Plus handbook for children, or excuse me, BadgerCare Plus program for children. And then, as I said earlier, sort of that CHIP program covers some of the higher income. For BadgerCare in Wisconsin, I know in other states they actually have very separate programs. You have sort of Medicaid for children, and then you have CHIP for children. And they treat them as completely separate programs. In Wisconsin, we put that under the umbrella of BadgerCare Plus, and so that's why we say, for BadgerCare Plus, it's up to 306% of the federal poverty level for children. And so these BadgerCare Plus rules that I've been talking about, how to count income and things like that, apply to both the sort of these lower income Medicaid children and then the higher income CHIP children. It sort of applies to them. The exceptions on the CHIP kids sometimes have a few different rules, and that was related to some of the crowd out policies about other health insurance they may have that I mentioned earlier, and also not able to backdate benefits and things like that. But for income counting, generally it's the same for the Medicaid kids and the CHIP kids. So, and you don't, as an application, on your guys' side. Most people don't even know about, I think, about CHIP. That's more of a term we use sort of, I wouldn't say internally, but it's not, we refer to it all as a BadgerCarePlus umbrella. So when you're looking at a notice of decision or anything like that, it's not going to tell you this person was eligible for CHIP or this person was
Right.
not eligible for CHIP. It'll really just refer to BadgerCarePlus as a whole. We're just including the CHIP information in this presentation so that you understand why some of those higher income kids may not be eligible for having other insurance or something like that. And just also so you guys kind of have an understanding of sort of the federal programs that are, underpinning this BadgerCarePlus program. Yep.
Great.
Any other questions, Adam?
There is one, but I'm just going to respond to it directly in chat.
Okay. All great. So I'll move on to special situations. So there's a few types of special situations. We have presumptive eligibility, which you may know as express enrollment, gap filling, the former foster care youth population, income extensions, continuous eligibility for pregnant women, continuous eligibility for newborns, the BadgerCarePlus prenatal program, which we had mentioned, I think, in the earlier session when it came to people who are non-qualifying immigrants or inmates who are pregnant, family planning only services, and then premiums. So presumptive eligibility, also known as PE, also known as express enrollment or EE, or also known as temporary enrollment or TE, I think it's had many different forms over the years, provides up to 60 days of benefits before applying for ongoing benefits through the Income Maintenance Agency. It's available to children, pregnant women, and adults under age 65. Just to note, PE has been temporarily extended to elderly, blind, and disabled adults during the COVID-19 public health emergency. So that's sort of a temporary population we have at this time. So PE is facilitated through partners, providers, and or qualified hospitals. Income maintenance agencies are not the ones who are doing these, processing the PE applications or doing the eligibility determinations. There is a streamlined online application for BadgerCarePlus or family planning only services, PE, that's on Access. That's what the partners, providers, and qualified hospitals use to do that sort of temporary eligibility determination. I'll go back real quick. And just to note, like the purpose of PE is really just if somebody, for example, is showing up to their doctor's office to get services and they don't have coverage, they don't have insurance, they're not enrolled in BadgerCarePlus or anything like that at the time, but it looks like the person might be eligible for BadgerCarePlus if they were to apply. This is sort of a way for the partner, provider, or hospital to sort of get this person who looks as if they would be eligible for BadgerCarePlus to just get them into those temporary services so that they can get their healthcare services right away, and then sort of gives them that coverage while they're, and the intention is that they would then apply for the regular benefits, and so they would have that coverage for that period of time to apply, and then to get up to 30 days it may take for them to get their eligibility. So that's sort of the purpose of EE stuff. Gap filling. So in most cases, eligibility for BadgerCarePlus is based on monthly income. At the marketplace, eligibility for APTCs is based on expected annual income, which you'll get into, I'm sure, in future sessions. Only people with household income above 100% of the FPL are eligible for APTCs. So someone can be ineligible for BadgerCarePlus because of high monthly income and also ineligible for APTCs because of a low annual income. So for example, James is unemployed for most of 2020, starts a job in October earning $3,000 a month. As a single adult, he's well above the monthly income limit of $1,063 for BadgerCarePlus. But his annual income is only $9,000, which puts him below 100% FPL and makes him ineligible for APTC. So he's kind of stuck in between. In situations like these, individuals can enroll in BadgerCarePlus through the end of the calendar year based on their annual income. So they can get that coverage through BadgerCarePlus in that situation. This type of enrollment is called gap filling. So gap filling enrollment can happen when the marketplace sends an application to Wisconsin that has been identified as a possible gap filling situation. So in that case, the marketplace is directly telling the Income Maintenance Agency that this could be a gap filling person. The applicant has a letter from the marketplace stating that they may be eligible under gap filling rules. And the IM agency identifies through their own processes that an applicant or member appears to be eligible under gap filling rules. And then also an applicant or member themselves can just directly request a determination to the income maintenance agency based on the gap filling rules. So somebody could, if they think that they're falling into this, they could directly communicate with our IM agency and request that the IM agency looks at the gap filling rules. Even if a person is tested under gap filling rules, they may not be eligible for BadgerCarePlus. In most cases, this is because they did not report all of their information when applying at the marketplace. So the marketplace thought that they were in this situation, but once the income maintenance agency actually looked at, the case and the person's income, it turns out they're actually not eligible. Someone denied for gap filling can provide updated information, updated income information to the marketplace, or appeal their marketplace decision at that point. And then getting into another, oh, sorry, Adam, was there a question?
I just wanted to reinforce the gap filling thing. Because it's more common than you would think. And the systems, despite there being several internal mechanisms designed to catch it, it's still not perfect. Because you might see, a lot of the times it's going to be you requesting on someone's behalf that the agency look at their annual income. And that might be for, a lot of times it's students whose income fluctuates, and you can predict it based on, their scholarships and things for the year. Or if someone's unemployment is running out at a certain time during the year, and you say, this is all this person's going to get, then it's going to be way under, 12,000 for the year. You may have to make that request for a person. So just remember to do that, to keep that in your back pocket, back your mind, to make that request for people.
And also, I'd like to piggyback on that, Adam, if I could. This is Masih
Please.
speaking. When you're communicating to the IM agency and you're reporting information, keep in mind that the IM agency is listening to what is being self-reported by the applicant. Say, for instance, a mom and a dad have a college student, but they reported that the college student is no longer living in the home, then they're just looking at the household size of 2. But if they're in fact still responsible for that individual and he's coming back, they need to effectively communicate that they're still claiming him, that they're still taking care of him, so that they can look at that case as a gap filling. So being upfront and disclosing full information, the IM agency is dependent on what is being reported to them. I hope that's clear.
Yeah, that is something to watch out for. I think it's clear, but yeah, watching out for people who, coming from the marketplace aren't aware of certain things that they failed to report or didn't realize was income. That kind of stuff is always, it's always good to double check your income before you hopefully not get someone's hopes up. That does happen from time to time, but just remember to let the IM agency make that determination. But definitely you can ask, say, hey, can you look at the annual for gap filling? Let me know what you see.
Right, exactly. And just be upfront and honest with both, not only the marketplace, but also the IM agency as well. Thank you.
Thanks.
Any other questions, Adam, on gap filling before I move on to the next special population?
There was one basically that I answered directly about whether or not the assister can still assist an applicant with gap or call the IM agency directly. And I just explained that the best practice is to, if you were either with the consumer or if you're, you can do a 3-way call to basically get the IM agency on the phone is the best way to do a gap case. So you can walk it through together.
Sure. Right. Great. So I'll move on to the next one. So former foster care youth. So anyone who was in foster care, subsidized guardianship, or court-ordered kinship care when they turned 18, we would consider them to be a former foster care youth. No income limit is applied to this population until age 26. So they can be eligible for BadgerCarePlus regardless of income if they are in this population. And I should say that I don't know if it's, no, it's this is for people who they didn't have to be in Wisconsin when they were in, foster care, out of home care, when they turned 18. So they could have been from, Minnesota and were in foster care in Minnesota and turned 18 there. But since then they have moved and they are now living in Wisconsin and they're under age 26. So it doesn't have to be somebody who had been in Wisconsin the whole time. They just have to be in Wisconsin now. All right, earned income extensions. So when a parent or caretaker relative's income goes above 100% of the FPL due to increased earnings, their eligibility and their children's eligibility is extended by 12 months. So this extension continues as long as the household continues to meet basic non-financial rules. There's no income limit during the extension. However, if the household's verified income goes below 100% of the FPL during the extension, the household will also go back to normal BadgerCarePlus rules. So they would go out of the extension and back into normal BadgerCarePlus. This is also known as transitional medical assistance. So that's, I think, the term that the feds use. So you may have heard that if you're listening to anybody talking about federal programs, and then other states may also use that term. But transitional medical assistance, we call it in Wisconsin, extensions or earned income extensions or BadgerCarePlus extensions. Again, the purpose of this is sort of to, when people have an income increase, just to give them a little transition time, so we're not, just completely dropping them off of BadgerCarePlus benefits, and they sort of have that time, with their new job or their new income, and then to be able to transition out of BadgerCarePlus to presumably another type of health insurance through their employer or through the marketplace or something like that. Continuous eligibility. So pregnant women who become eligible for BadgerCarePlus stay eligible through the end of the pregnancy. So they are also eligible during a postpartum period that lasts until the end of the month in which the 60th day after the pregnancy occurs. Babies who are born to a mother enrolled in BadgerCarePlus or Medicaid stay eligible for BadgerCarePlus until they turn 13 months old. So you may have heard of like continuously eligible newborns or KINs or something like that. That's the population we're talking about here. These eligibility periods for pregnant women and newborns continue even if the household's income goes over the program's income limit. And then getting into the prenatal program a little more. So it is available to pregnant women who meet all other rules of BadgerCarePlus, but do not qualify because they do not have a qualifying immigration status. And again, for pregnant women, that would be somebody who is not legally present in the United States, and then are inmates of a public institution. So people who are pregnant women who are in jail or prison would also be eligible for this prenatal plan. Women are not eligible for the BadgerCarePlus prenatal plan if they are currently covered by any HIPAA health insurance policy. They may not have current or past access to an employer-sponsored health insurance plan in which the employer pays at least 80% of the premium. Women enrolled in BadgerCarePlus prenatal do not qualify for backdated eligibility. So that's that some populations can ask for 3 months of past eligibility before their application month. So the prenatal folks do not have that. And then continuous eligibility for pregnant women does not apply to women enrolled in the BadgerCarePlus prenatal plan. So that only applies to the pregnant women under the regular BadgerCarePlus plan. All right, so family planning only services. This is a limited benefit plan for women and men of childbearing or reproductive age. It covers certain services and supplies related to family planning. So it's pretty limited. It's really just those family planning and related services. Income limit is 306% of the FPL, and household size is always 1. It's just that person, and only the individual's own income is counted. So regardless of what their household circumstances are, if they have kids, if they have a spouse, if they, live with their parents or whatever, it doesn't matter. For family planning only services, we just look at that person as a household of 1 and that person's own income. All right, so children's premiums. So children with household income above 201% of the FPL must pay premiums except for pregnant minors, former foster care youth, children who have met a BadgerCarePlus deductible during the remainder of that deductible period, children in a BadgerCarePlus extension, all children under age 1, including those continuously eligible newborns that I mentioned earlier, And American Indian or Alaska Native tribal members, the son or daughter of a tribal member, the grandson or granddaughter of a tribal member, or anyone otherwise eligible to receive Indian health services. So these are all people who children who do not pay premiums, even if their income is above 201% of the FPL. Failure to pay required premiums results in a 3-month restrictive re-enrollment period, also known as an RRP. Individuals can re-enroll during the RRP if they pay their owed premiums. So just to note, the Children's BadgerCarePlus premiums are suspended until after this federal public health emergency ends that's related to COVID-19. So this is one of the temporary rules related to COVID-19. Childless adults. So childless adults with income 50 to 100% of the FPL must pay premiums, except for, again, American Indian or Alaska Native tribal members, the son or daughter of a tribal member, the grandson or granddaughter of a tribal member, or anyone otherwise eligible to receive Indian health services, individuals who are disabled, individuals who have resided or are expected to be residing in an institution for at least 30 days, individuals who are homeless or have been homeless in the last 12 months, or individuals who are deceased. So again, this is a list of people who are not childless adults who do not pay premiums. Childless adults can complete a health survey that may reduce their premium. And childless adults are also required to answer a treatment needs question that asks about substance use. So that was, I think if you may remember from the COVID-19 temporary rules that Michelle talked about earlier, during this time, the treatment needs question is suspended until after this COVID-19 related federal public health emergency ends. And then again, also the premiums as well are also suspended during this time. Yep, and getting into the COVID temporary rules, this is the same slide as Michelle had read off earlier. The different temporary changes that have been made to BadgerCarePlus policy during this federal public health emergency. I won't read off completely everything here since I think I've covered it before, but just as a reminder, we will be having a session on October 5th, I believe, to go over these COVID-19 temporary rules in more detail. So that will have much more information at that session on October 5th. All right, so getting into additional resources. Actually, before I get into that, Adam, are there any questions from this most recent session?
There's a clarifying question around the continuous eligibility for pregnant women after delivery. So the question is, the mom has a baby. They just want to confirm the coverage doesn't end at the end of that month, even if their income is over 100% FPL.
That's right. And actually, for pregnant women, the income limit is 306%.
Yeah, that's not. Yeah, go ahead.
Yeah, and so during the postpartum period, yes, that would continue on regardless of the income, and it would last. So if somebody's pregnancy ended today, September 21st, the 60th day after the pregnancy ends, and actually I just realized this slide is slightly incorrect. It really should say the 60th day after the pregnancy ends, not the pregnancy occurs. But after the pregnancy ends, so that would be in November, and so it would be the end of November that the postpartum period would go to.
Right. So they're still counting as a pregnant woman during that time.
Yes. Yes,
Yeah.
they are still kind of, and then it would be after that ends. So I guess starting December, that's when we would transition the person to, perhaps they would be a BadgerCarePlus adult, or excuse me, parent. So perhaps we'd be looking at them for parent rules at that time, and then we would be looking at the 100% of the FPL limit
Right.
as a parent, and so on. And so that would be from December and ongoing after that postpartum period.
Cool. I think that that covers that really well. One other question came in. I have had patients struggle getting coverage due to non-compliance with child support. Can you discuss the rules for this? Which is a really good question.
That is a very good question. I know that I might actually have to take that one back.
I can
don't know if I
talk about child support if you'd like, Rachel.
Yeah, that would be great. Thanks.
Okay, great. So in an individual, it will be allowed to stay on BadgerCarePlus if they comply with child support. However, if the woman was not compliant with child support for the birth of her first child, but then becomes pregnant again, that sanction will be lifted for the duration of that pregnancy. And if she does not comply with child support for that child and the other child again, that sanction will be given again. So the only time that the non-compliant with child support would ever be lifted would be if she were to become pregnant again. I hope you find that helpful.
Thanks, Basiel. Adam, do you think that answered that person's question, or?
I think so. Because that's what I would imagine the person, if they're seeing somebody struggle to get eligibility, that definitely could satisfy, or not satisfy, but like cover that situation is probably what they've seen. And just let me see here. There's another question. Maciel, did you have something to add on that or no?
Yes. Also, I would just communicate with child support, especially if the mother's in fear, she's in an abusive relationship. There are just causes that can be granted for their particular situation. So if it's a reason for fear or something of that type of situation, if they communicate with the worker, they should be able to go ahead and make a notation. It's as long as they're compliant. Compliance can be just communicating with the worker and what the type of situation they're living in.
Right. Yeah. Thank you for bringing that up. That's what I was going to say about just cause.
Yes. So, and if anything, at the end of this presentation, we'll have an email address to send questions. And if you have a particular situation you want us to take a look into, please let us know.
Great. Adam, any other questions before I move on to resources?
There's one more question about that same case, basically. So, pregnant woman after the 60th day after delivery. Would you have the mother apply with a new application or just update income or update the application?
No. So if it's somebody who has been open under BadgerCarePlus is a pregnant woman, and then it's after the pregnancy is ended and they go through the postpartum period, they don't need to do a new application. At that point, they would just report to their income maintenance agency that the pregnancy. Actually, they should have already reported that the pregnancy has ended when it did. But then the income maintenance agency at the end of the postpartum period will redetermine the eligibility under as a parent or whatever.
Right.
Depending on the situation. So it doesn't require a brand new application at that point. It's essentially sort of the agency sort of processing it almost as like a change report in that instance, and then they would do that. All right. Any other questions?
I'm looking at one more. It says, it's not worded as a question, so let me see if I can work this out. Same rule applies for a non-citizen, non-resident, because I've seen ending postpartum way before the 60 days. So I'm guessing that's asking for the clarification of a non-qualifying immigrant who gives birth, which would be the coverage ends, right, with the delivery, and there is no 60 days?
Yeah. So I'm assuming that's talking about somebody who is enrolled in the BadgerCarePlus prenatal plan. So not as a pregnant woman in the regular BadgerCarePlus program, but specifically in that prenatal plan.
Right.
Yes. So I don't know if I have it on the slide here, but yes, they don't have the continuous eligibility, and so it doesn't cover that postpartum period.
It doesn't cover the postpartum period, or at least it doesn't grant extra coverage. However, keep in mind, if you have a pregnant, non-qualifying pregnant woman whose coverage ends and she still hasn't gone to her 6-week checkup, have her continue to go, because we encourage our providers to bill globally, and it will be covered, that added visit after the birth of the baby, even if BadgerCarePlus prenatal has ended, that that visit will be covered under global billing. So I would always encourage them to follow up with their checkup after the birth of the baby, simply because I know that some women are afraid to go because they realize their BadgerCare Plus for prenatal has ended. But under global billing, that bill will be taken care of.
Great. Good questions, everybody. There's one more. I'm going to follow up on it directly, though, so we can keep moving, because I know we're at or after time now.
All right, so just getting into the resources. Again, this is kind of a repeat of some of the resources that Michelle Furr had talked about earlier today. So of course you can contact the income maintenance agency for the area that would be local to the person you're helping. Member services, also good for general member questions, information about covered services, help with finding local IM agency. Again, that number is 800-362-3002. Information about Wisconsin's healthcare programs. You can find those member fact sheets at the dhs.wisconsin.gov/forward/health/index.htm website. And again, you can also just internet search for Forward Health or DHS Wisconsin or anything like that and find these resources. And that information for partners in Southeast Wisconsin, which as Maciel clarified earlier, that while some of the information is specific to Southeast Wisconsin, a whole bunch of it actually applies statewide. So even folks outside of Southeast Wisconsin will find some valuable information in that publication, P01725. And again, putting in a plug for the policy handbooks, forms and directories manuals, BadgerCarePlus eligibility handbook specifically. The link is there, but you could also do an internet search for BadgerCarePlus eligibility handbook, and I'm pretty sure it should pop up. So again, that'll have these policies in much more detail if you want to take a look. And again, as Maciel said earlier, we do have a email that you can send questions to, and we'll take a look at that. So the DHS Forward Health Partners at wisconsin.gov. Please send your questions there. All right, I think that's it. All I have. So any additional questions, Adam?
Yeah, I'm just going to be answering a few of them. One I think is really important to point out. Somebody's asking if person in Wisconsin who has BadgerCare Plus can go to any provider to be seen. And I think that's a good point to talk about HMO enrollment.
Sure. And actually, Maciel, is this something you might be able to speak a little bit more about than I can?
Absolutely, absolutely can. So when an individual goes ahead and applies for the Medicaid coverage through BadgerCare Plus, they'll have, if they're new to the system and they don't have already family members in the household who have an HMO, they will have an opportunity to go ahead and select an HMO in the area that they reside, that serves the area that they reside. So they will have a forward health card. If they will have straight Title 19, which is also known as fee for service, to see a provider to start getting coverage. And that's when I would encourage that individual who's not in an HMO and is establishing with a new doctor to find out what HMOs their doctors accept so that they can do an educated enrollment with the HMO enrollment broker to select that plan that would have their doctors in. The other thing to keep in mind is that if a Wisconsin resident has BadgerCare Plus, regardless of their HMO coverage that they have, and they are out of state, the only coverage that would be allowed or permittable would be emergency services, not routine care. So say, for instance, if I'm pregnant and I need to go ahead and have a follow-up with my OBGYN, but I'm visiting relatives and I have an old OBGYN that I was seeing or what have you, I cannot schedule an appointment with that doctor for routine care. It would only be if I was visiting relatives and I went into labor. That would be considered an emergency service. Also, I don't believe that urgent care centers are covered, so it would be only outside of the state of Wisconsin would only be emergency services. And for further questions on that, I would refer to the HMO that the members enrolled in so that they can get the most up-to-date information available to them. Adam, does that make sense?
Yeah, no, I thought that was a perfect explanation. So a lot of the time, well, just for the one, I guess, takeaway that you'll see as assisters, oftentimes you will be helping consumers select an HMO. If they're on BadgerCare for the first time or haven't been on in a while, there's an HMO enrollment number at 1-800-291-2002, something like that. We can double check that.
Well, it's also on that Southeast Wisconsin handbook.
Yeah, you can even Google it too. It's just,
Mm-hmm.
Wisconsin BadgerCare HMO enrollment. You'll get the phone number.
And I would encourage the sisters, and I know that this is going to be a heavy time with open enrollment and such. If you have folks that need to enroll into an HMO, have them reach out to the HMO enrollment broker. They have data systems that can scan. What they do is they ask the family, what are the doctors that they're interested in seeing or have existing relationships with, and let them know which HMO would best suit their needs. So I would definitely utilize the HMO enrollment broker to make those decisions and make those enrollments.
Yep. And looks like 2 more questions. One, right on that same topic, Maciel, can a person change HMOs, or can you describe the rules for changing HMOs?
Absolutely. If someone is actually new to the system, they apply for BadgerCarePlus, get fee for service, and they do not proactively enroll into an HMO, they will have the first 3 months, they will be allowed to go ahead and change HMOs during that duration. So say, for instance, if you do not contact the HMO enrollment broker and you do not select an HMO, what the state of Wisconsin does is they go ahead and automatically assign individuals to an HMO that may suit their needs. It's not always perfect, so I always encourage my folks to try to reach out to find out exactly what their providers accept as far as the HMOs in their areas, make those proactive choices for enrollment. But if you are automatically enrolled into an HMO without you choosing, you do have the first 3 months of that enrollment to make a change, and thereafter you would be locked in for an additional 9 months. So the state of Wisconsin does require individuals to be enrolled into an HMO for 12 months, and thereafter that 12-month period, they can go ahead and change HMOs if need be. Of course, life does happen, situations take place. Someone may need to disenroll from the HMO for a short period of time to finish care with somebody or whatever. Always reach out to the HMO enrollment broker. They can always offer your options to you, and also work with your HMO advocate. Make sure that you openly discuss the concerns that you have. They may very well be able to work with the doctor you'd like to see who doesn't accept the HMO and have a single case agreement. So there are options out there. Just ask for help and we'll be able to go ahead and guide you if need be.
And I think we'll do one more question, and on that same topic, Maciel. Do you
Okay.
have to have an HMO? And I could think of a couple populations that don't, but generally speaking, the answer is yes. Is that right?
Yes. Now in the year 2020, the majority of the state have HMOs available to them, whether they be in BadgerCarePlus, whether it be an SSI. So yes, the answer is generally you would have to be in an HMO, but there are benefits of being an HMO. You have a home base where they have a network of providers that can go ahead and assist you with the care that you need. But I would definitely work with them or ask questions from the HMO enrollment broker if there's a situation where you feel like the HMO wouldn't be a good fit. Chances are they can make those situations work out and still remain in the HMO, but the state of Wisconsin does require for the majority of the population would be enrolled into an HMO.
Right. Okay. Then I think we are good. We are well over time, I believe, but we've had some great questions. One, just a reminder, we'll have access to these PowerPoint slides as a PDF, which we will let everybody know where they can find them on our site. And then same thing, this presentation has been recorded, and we will let everybody know where to access this presentation later. Anything else from our geez, this is normally the part where I would say, hey, everybody give a hand for our panelists. So I'm assuming you're all applauding at home. I think that's the best way to do it. So for Michelle and Rachel and Maciel from DHS, thank you so much. We will see Rachel and Michelle again tomorrow morning. Maciel probably as well, I'm guessing. Maciel, are you on tomorrow morning? Was that part of the plan for EBD or no?
Yes, definitely.
Okay.
I'll be there to support.
Cool. Well, I think everybody did a wonderful job, and I think the questions that came in were fantastic. So thank you, everybody, for participating, and we will see you tomorrow. Mike, any final thoughts that we need tech stuff or anything?